Okay, Tushy team, another success story. A woman came in 6 weeks ago. She found me through her gynecologist. She had an external hemorrhoid. So here's the anus. Here's putting a finger inside. You see this little flap right here, this flap of skin that we have on our hand? Yeah, that's just like the anus. She had this and she didn't like it. She was told she needed an internal and external hemorrhoidectomy. And that's a lot of surgery with stitches. Usually creates a bump after because of the stitches. And her doctor said, go see Dr. Rosenfeld. So she came in to see me, told me what her issues were, and I did an examination. And on the inside, her internal hemorrhoids were not large, they were normal size, and she was having no symptoms of her internal hemorrhoids. They weren't coming out and going in, they weren't bleeding, they weren't causing pressure or pain. Her biggest problem was this outside tag of skin from the external hemorrhoids. So this vein that you see on my hand, we have these purple veins outside, and when they swell and stretch, you get this extra skin. For women, typically in pregnancy from having to bear down to have children, and men from constipation. And hemorrhoids affect men and women equally. So she didn't like it. Why doesn't matter, but there's a gamut of reasons. It swells when I go to the bathroom. It's uncomfortable when I wipe. I don't like the way it looks. My partner doesn't like the way it looks. I don't feel sexy. I can't wear my thong underwear. I'm a dancer and I expose that area. I'm an adult film and I have to show that area on film. Doesn't matter, Tushy team. I'm not here to judge. I'm here to solve problems. So what does a patient do when this tag is bothersome? Well, they come into the office and I give them a shot, like going to the dentist. Once it's numb, I remove it. I don't put stitches in. You don't need to. It just stops the bleeding, but creates a lot of swelling because it's a foreign body. Just pressure will stop the bleeding. Patient goes home with prescription for some pain pills, 6 pain tablets total. They usually take 1 or 2, 4 at the most, and they recover. With good bowel movements and time, everything gets better. Well, she came in 6 weeks later, as I request all the patients come in, and the area was flat. She was so happy. She already told 2 of her friends. That is the common scenario of what happens when a male or a female patient has their external hemorrhoid or hemorrhoids removed in the office. The ultimate majority of the time, it is about a 3 to 7 day recovery, and the area flattens, and they feel great because the symptoms that they had are now gone.